What happens is there's a part of the brain whose work function is to monitor what is going on in the life of the person, to take decision, and to watch, to control the emotion, and then the ability to take decisions and to operate properly. There's a part of the brain that does that. But what happens when somebody gets into drug? The first thing that happens is that ability is suppressed. Then the other area that would want the person to just go all out is activated.
Without thinking.
Without thinking.
Like a bypass.
Yes. So now this one is suppressed, this one is activated. So that drug, when it happens, a lot of neurotransmitters, dopamine, let me just use that word. That is the euphoria, rejoicing hormone. They are produced much more than necessary because the brain produces them in a controlled level, at control level. But when drug comes in, it is excessively produced. Now that it's excessively produced, it produces excessive satisfaction. And at that point, when it's repeated, the other area I told you that records memory will see that thing happened when a certain substance came into the brain. And then when that substance, when that person thinks about that substance, that part of the brain will say, go for it. Because that's the only thing that matters at that point in the life of that person. It's like it has reset the brain to recognize that substance as the only thing that will make him human being. That is what actually happens. And although we have also seen from some scan procedures that there may somehow be some damages in some portions of the brain that happen in the portion of the brain.
Is that bad?
Is that bad? And these damages, some of them take a very long time to heal. That is why detoxification and rehabilitation does not heal that personality. Until that psychotherapy is given, and that period of time that psychotherapy has to be given to help the brain recover itself.
Tell us how you got here. Tell us how you rose.
We have discussed the chemistry of addiction. Today we are going to be looking at the biology of it. What happens before you took the first sip? Before you took the first drug, before you did anything you did? Are we genetically predisposed to be addicted to substance? In other words, is it in our DNA? So we're going to be looking at the biology of it before we were giving birth to. Is it possible to pass addictive gene from father to child, from great grandfather to child? So here with me is Dr. Mba, of course, and he'll be doing justice to this topic. Let us welcome Dr. Mba. You're welcome, sir.
Thank you very much. It's a pleasure.
Yes, it's always a pleasure to have you here.
Thank you.
You know, the last one you did, it was really wonderful. And I believe a lot of people have been helped by it. And today, people were asking certain questions and said, look, what if it's not really my fault? What if it's my father's fault? What if it's my great-grandfather's fault? And then what if, we are predestined to be addicted to substance as a result of my genetics, my DNA? So the question is it possible for a father to pass addictive genes to a child?
Well, I will say yes, and I will say no.
Okay.
I will say yes, because in life, we inherit some things from our parents, from the womb. We inherit from the father, we inherit from the mother, some characteristics that will later define us. So in that instance, I may say a father can pass it to the child.
Wow.
But now, this is the catch.
Okay.
Before one gets addicted, it's somehow a choice at the initial stage.
Okay.
Choice that the person wouldn't want to do if he understands the harmful effect at the
Yeah.
end.
Yeah.
So it's like that person is trying to experiment.
Yeah.
That's one aspect. Then I will say no,
Mm.
because in life there are some habits we also outgrow.
Okay.
We decide not to engage ourselves in certain things
Yeah, that's true.
by the power of willpower.
Yeah, that's true.
So in this instance, it's either way.
Okay.
But the good thing about it is that what we become actually, what we get ourselves involved actually, is from first and foremost our personal decision and willpower.
Okay. Okay.
Then after that, the child could understudy the father.
Okay.
That's another problem there.
Okay.
The child could be watching what the father is doing, and children they learn things easily. So when they now learn that when their father is into addiction or into the wrong use of drugs or substances,
Yeah.
that child will definitely want to test it and see. There have been stories of people who, because their parents send them to go and buy cigarette, for instance,
Yeah, that's true.
then they will now want to experiment
Yeah, that's
and
true.
eventually become smokers.
Yes, that's true.
That tendency is inherent in every person.
Oh,
But then our willpower determines the lane we'll
okay,
follow.
that's true. I've seen videos of parents passing on weed to their kids, and then you see them, they're smoking this weed, and sometimes there's something they call, is it secondary smoke or something like that?
Yes, passive
Yeah.
smoker.
Yeah, so so you are just within that environment, and
Exactly.
it's even as dangerous as this. So what's happening to that child that is maybe 1 or 2 or a couple of months old, and the dad is smoking weed around that environment?
Yeah,
What's happening to that
yeah,
child, or what will happen to that child eventually?
what is happening at that level,
Yeah.
though the child may not manifest the tendencies of addiction at that point,
Okay.
but the brain will pick it.
Oh.
You see, in the brain, there's a compartment that its function is to record memories. So that child, that thing will be recorded as memory in the brain of that child.
Oh.
This also brings me to say this as well. Some people, when they give birth to children, some of them will give them whiskey.
Yes, people do that.
People do that.
It's so wrong.
And then that whiskey will reset the brain of that child.
Oh.
Set it at a higher level that even a small drop of it again will not cause problem. But then when the child is now growing, the child will be tilted towards taking more of that whiskey to enjoy that euphoria that comes with it.
So it will just continue to
It will
increase
just
the
continue to
threshold.
increase in threshold.
Oh.
And eventually you now see this child behaving towards addictive tendencies.
Yeah.
Even when he is not living with the father again, people will begin to wonder, what is happening? I'm trying to train this child properly, but he's not listening.
Yeah.
It's because the brain that was reset,
Okay, just
rewired initially, is responding to stimuli that will draw that child into addiction.
Okay. Looking at genetics, right? And what happens? We've seen instances where child A took a substance and is okay and never took it again. Child B takes that same substance and becomes addicted
to it,
and then recovers. And then you have child C that will take that substance and almost never recover. What happens? Is it biology? What happened that this one is able to just take it and never take it again? This one took it, recovered, and this one took it, never recovered. Is it home training? What happened?
Okay, what is happening here is this. The child that takes it and it didn't affect him so much, that child had not tried it before. Maybe either by passive exposure or by deliberately taking it. Such a person had not taken it. So the brain has not recorded any form of memory concerning that euphoria, that satisfaction that comes from that substance or drug. Then the second person that takes it that may be the first time that person is taking it. He experiences some form of euphoria, satisfaction that he had never experienced before. So that now pushes him after a while to go back and see if he can experience that thing again. And when he now does it repeatedly, he will be pushed into addiction.
Oh.
That is what happened to this second person. The third person, the third scenario we were giving is what? The child takes it.
Yes.
Have what?
Yeah. Okay. The child takes it and then never recovers.
And never recover.
Yes.
The child that takes it and never recover is that child that has that memory before. He had tested it somehow before,
Okay.
maybe passively. Now, when he now takes a second one, it's like a repetition. And then once that repetition is made, that the brain will be pushing that child to tell that child that this is the way to go. Other things don't count. Other things can give you satisfaction. And because the brain at that point has been rewired not to respond to a smaller dose of that substance, now the child wants to increased dose. That is why some people like young men, you see them, one will tell you he takes 6 bottles of beer.
Yeah,
it
that's
didn't
true.
happen to him.
Yeah, that's
the other
true.
one too
That's
funny
true.
too. And you see him,
And then the
this
guy is
crazy.
knocked down. Yeah,
Yes.
that's true.
So that's just the process that leads to
Okay.
such an habit or
Okay.
addiction.
Okay. So I don't know if you guys do this in your clinic or your center. I don't know
Okay.
what you call it, but have you guys taken your time maybe to check the number of people that inherited addiction, either from they saw their parents abusing substance and they started abusing it, or they saw their uncle abusing substance and they started abusing it? Like maybe if you people ask people as okay, who introduced you to your first drug or first substance? Yeah. What kind of answer do you get?
Yes,
when you ask them
we
this?
do ask such because it's also necessary.
Okay.
It's very important.
So that you can ward off
in
you can ward off
the
those
management.
people.
Yes. When you would have detoxified this person in the proper recovery, because recovery actually starts from the day the child is brought into the rehabilitation center. But the major recovery management begins when the detoxification has happened. That's at the point of rehabilitating this child. That is when the true recovery. And then that recovery management, that process, that person that introduced that child has to be far away from that person. Otherwise, once that client now sees that person, the memory is triggered
and connects
back and would want to go back.
Wow.
So we trace contact, as it were. Who introduced you first? How did you get into it? That person will now explain. That is also the process that when they are recovering, you have to take them away from such contacts.
Even if the person is the husband, because I've seen cases like this really, where the husband introduced the wife to drugs.
Exactly. That is why when we book clients, we don't call them addicts. When we book them, we have to book the family, their relatives. Because if you don't do that, recovery will be very difficult for that person. Because those other people who will now follow him up, will not know when he's tilting back to addiction, what we call relapse. So we bring all of them together. If it's a family member that has introduced him, that family member needs to be detoxified and rehabilitated. Because you can't bring out this bottle, for instance, from a clean water and you dip it in an oil and bring it back into that clean place. It will contaminate it.
That's true.
That's why we book both the client and the parents and the relatives. The only one we cannot bring in are his friends, because we cannot force anybody to come to us for detoxification and rehabilitation and then recovery.
Okay, that's now taking us to the environmental factor.
Good.
Okay, so what role does it really play? How critical is it it is in getting people addicted. I've seen there's this research
Mhm.
by a scientist, I think it was during Vietnam,
Okay.
and they found out that a lot of American soldiers were addicted and they came back home
Mm.
addicted to heroin, I think.
Yes.
And some of them that went back to good families,
Mhm.
you know, they eventually overcame it without needing
Amazing.
much of your
Much of-
help,
Yes. Yes.
professional help. But they
Yes.
found out that, people that didn't have that went back to be alone or went back to an environment that,
Mm.
they relapse and
Unwelcome.
relapse, and some of them never got out of it. So,
For
how
sure.
critical is our environment to getting people addicted and getting people to overcome
Overcome.
addiction?
Environment is very critical and vital.
Mm.
That is also the reason we also book the relatives of this
Okay.
patient or
Yeah.
this
Because that's
client,
the primary
because that is
environment
where that's the
now.
primary environment, and that's where it's going back. Now, a toxic environment will bring up a lot of stress for this
Mm.
client, and stress is one of the things, one of the triggers that push them. Financial stress, whatever stress, economic stress,
Oh.
educational stress. And when these things are happening, it's the environment. It's in the environment. And most of their peers are also part and parcel of the environment.
Mm.
So environment plays critical role, because if after detoxification and rehabilitation, you now send that person back into that toxic environment, that person will come back with relapse, because
Oh.
he will now be contaminated again. So
Mm.
environment is very critical. That is also the reason when we now detoxify clients, we
Mm.
advise that they leave the environment for a period of time,
Oh.
because definitely that you have removed drugs from an addict
Mm.
is not the solution to him not relapsing.
Mm.
At that point, the brain itself is set at a very high level, and is not, even the reactive circuits in the brain is set at a very high level, that
Mm.
if you now allow that person to go back to his peers, he will definitely be attracted to go and try that thing again, because the pressure is still there.
Mm.
So environment plays a big role. After detoxification and rehabilitation, we advise that they be kept away, but not in isolation, because isolation itself is a big
Probably
problem.
worse than
It's worse than
a bad
the
environment.
bad environment,
Mm.
because in that place, that is where the brain is playing out the previous old bad life.
Mm.
The person is thinking about it, and because of symptoms, the withdrawal symptoms, the
Mm.
person will be tilted towards, oh, how can I get it? Because at this point, he will see himself as not
Mm.
being complete.
Mm.
He's afraid. He's also angry that he engaged in that thing before. He also at this point cannot take critical decisions on his own as yet.
Mm.
So all this put together makes the environment very critical, that we also recondition the environment to suit him, to suit this new life he is now coming in to enjoy.
Okay. I don't want to frame and phrase this question this way. I want to look at the demographics now
Okay.
and see the people that were brought to your place, to your center. At what age most of them start abusing substance?
Okay. Most of them start abusing substance at their teenage age,
Mm.
because that is the time that these teenagers are very exploitative. They want to know.
Okay.
They want to know so many things. You see, children when they are growing, they'll be asking a lot of questions.
A lot.
Yes. So at that age, if they find out that somebody around them is taking this substance, abusing substances, they will begin to ask that person, why are you doing this? Honestly, they are very honest.
Yes.
But then, when the person now refuses to tell them why he's doing it, they
want to
want
find
to
out.
experiment. So at that teenage age, that's when most of them are introduced. But they may not have the opportunity of getting into addiction at that point, until they are growing up, and they now are exposed to money. Maybe when they now going to the university, and they're giving
Yeah.
allowance and all those,
They divert
and
some of
then
the
they
funds.
divert all the funds into experimenting that thing that they have had knowledge of
Yeah.
before. But
Wow.
basically, majorly, most of these clients that we also have are from, they're not really from poor families, as it were.
Okay.
Most of them are not really from poor families. But those who are from poor families must have made friends with them.
Okay.
And it's in that friendship that they introduce them to this thing. And then when they now get into it, they wouldn't have money again to continue to satisfy their desires. That is when you see them going into either stealing or doing so many odd things to make
Yeah.
money and sustain themselves.
Yeah, that's true. It could also be that maybe the people from poor families cannot, I don't want to use the word cannot afford the people, but maybe are not that aware to
Okay.
come to your places. There could be
Yeah.
a possibility because I've seen ghettos. You know, I had a farm in a ghetto at some point,
Yeah.
you know, during my university days and right after that NYC days. I noticed when I was going to my farm, I noticed the marijuana, the Indian hemp, almost on every. You just know you're just seeing it from every direction.
Yeah.
So I think maybe they can't. They don't even know something is wrong with them, or their parents probably doesn't care that much or can't afford you people.
Yeah,
Maybe.
it is either way. But what happens is, like we said, environment affects somebody's character in the end.
Yeah.
In that environment that they are, these things are easy to come by.
That's true. No, that's very
All right.
true.
Now,
You're on your own, somebody is hawking
it's
it around
hacking it.
and say, take.
Yeah.
Yes, I've seen it.
Yes. And
Yeah.
unfortunately, you see these addicts, they show more love than people who are in
Yeah,
their
that's the
real
weirdest
sense.
thing.
That's the wildest thing.
Yeah, it's
They
so.
show much love that even that boy will not have money to buy it. He'll buy it for him. Unlike us, when even we are saying our brother is thirsty, we can't give him money to go and buy drink, to buy water. So that is what happens. And most of them, because they are now used to that high level of response to drugs, they will always like to do it. Their parents don't know. They don't know the harm it's causing in their body, the harm is causing in their growth or in life.
Yeah.
So what they just see that, you have started again, John. I have told you, get out. He thought
Just
he has
like
solved
that.
the
No, he
problem.
hasn't.
He hasn't.
That child is
And
incapable of helping
he
himself.
is incapable because he has been taken over by this. His personality has been taken over by it. So most of them, they will not even seek for help. Or if they hear, just let me give you an instance. Somebody who is having headache, that person will want to go and buy paracetamol and take.
That's true.
Instead of coming to hospital to see, so that they will examine him and see what actually is wrong and take care of it.
That's true.
The next question, if you ask that person, will tell you it's very expensive to go to that place.
Wrong.
But then he has not even gone there to find out what it costs.
That's true.
That is also what is happening here. People, even when they hear that people have been addicted can be helped, they'll tell you, I don't have the money to go and start doing this thing. So because of that, the cycle continues. And you see these children, some of them, the teenagers, they will have teenage pregnancy, produce children and train them in that same trajectory.
Yeah, that's true. There's
The cycle continues.
That's true. There's this video that's making the rounds recently. I think they uploaded it about 3 days ago.
Yeah.
So it's about, there's something trending now where people steal and then they are made to dance in a funny way, and then there's this one that is pathetic. This girl, 2 girls, they stole one basic stuff like that. I've forgotten what it is. And, the mob gathered, but there's a statement there that they stole those things. They want to sell the proceeds of what they've stolen to buy drugs. So bringing this now, I
Yeah.
think
Yeah.
that's exactly what happens.
That's
At
what
some
happened.
point, they start stealing. They go public and start stealing.
In fact, there was one case we had.
Yes.
The boy was in the house, and then he started stealing small, but they didn't take cognizance of
Cognizance of
what
it.
is happening.
Yes, sir.
Till a point, he started he will pull out their window and go and sell as scrap
To
just
that
to
extent.
just
to get that
get
fix.
that fix.
Whoa.
So such things is just gradual. Then they get deeper and deeper. So I will also advise parents or guardians or people who love these people. If you see them doing it at that small level, please, that is the time to get them out of this
Okay.
problem.
And that's why we are going to be having the number on the description of this YouTube video. We want people to understand that, look, there is hope. Okay, so if you know these people, you can reach out to them and then so they can get help. If you are their parents, there is help. If you are their neighbor, there is help. As a collective, we have to do what is necessary to ensure we kick this menace out of our street.
That's
And
right.
then coming back here,
Yeah.
you said something about it's impossible or almost impossible for a child to inherit the addictive personality of the parents. So the question is, what about like childhood trauma? Is there a relationship or a correlation between childhood trauma and
And
addiction?
drug addiction. Definitely
Yes, sir.
there is. What happens in a child being abused or trauma of any type, at that point, that child will want to have a coping mechanism, how to have an escape from it. And usually, these children, unfortunately, will mix with other children who are passing through that same experience, who will also tell them how they are coming out of coping. So childhood trauma actually tilts towards the person who want to find some form of enjoyment, some form of relief. So it may be that some of them, they will start with prescription drugs. They will go and buy, because over the counter they buy those drugs, tramadol, codeine, and all those, because of the pain and the stress they're going through. And when they now say that it gives them relief, they want to take more. Because like I said, at the initial point they're taking it, what happens is that there is a hormone that is released that sets the response of the cells of the brain to all these drugs at a high level. At that small level they are introduced to it, they will want to take more because there's what we call tolerance. The brain now sees it as normal and would want to reduce the receptors. I'm sorry, I'm going to technical. So now let me explain. There's a messenger here that will tell this person what to do.
Okay, maybe just do like this so people can see.
So there's a messenger that will go and tell this person what to do.
Yes, sir.
Now, at the initial time that this messenger went there, that person sees, oh, there's another thing I could do to survive. So the level of response is high. The brain is set at that high level. Now, when this messenger comes, I say, is it not only you? It won't respond. So the messenger will come back and say there's nothing happening. So they will gather, two of them will go. At that point, something will happen. And this one will say, yes, you have come now. More of you should come. That is how people get into addiction. And then between that time that the excitement is weighing off and the time they will take another drug, then the person comes down to a very low level. That's why you see them, they become very fatigued. They become very low. And they feel like if they don't take it now, the next thing is death. It's real to them. The body has been that wired. So when that happens, the person goes in to take more and more and more. And some will take even overdose and get into trouble. That's how it happens.
Wow. Thank you so much for breaking this down. And there's this. I want to talk about absenteeism now
Mm.
because we live in the age where couples work.
Yeah.
The wife works,
Mhm.
the husband works,
Mhm.
and it's taking us back to an experiment, this rat pack experiment.
Yeah.
I've forgotten the year and by who, but this experiment was carried out, and they placed a group of rats in two different distinct environments.
Yeah.
And then these particular rats, group of rats, they were isolated and they laced the water with drugs.
Mhm.
And then these other rats we also placed in that same laced water,
Mm.
but in a different environment. But they had other things
Yeah.
to distract them.
Yeah.
And at some point, these rats here, it was easy for them not to be addicted to this water, even though everybody took this water
Mm.
at the same time before the introduction of those things in that environment. But
Yeah.
these guys in this other side, without this distraction, we are heavily, involved in let's say drugs now
Yeah.
because they lace the
Yeah.
water.
Yeah.
So the question here is when parents now are not home,
Mm.
so does it mean that the child is now exposed, or does it increase the number of people that become addicted? Now I'm saying it because you have first-hand data, right?
Yeah.
When people come to your center, and do many of them have both parents at work compared to there's a stay-at-home mom or a stay-at-home dad?
No, most of them have parents who are both at work.
Yeah.
And because they are not around them,
Hmm.
they are exposed.
Hmm.
Whatever they are doing, nobody is guiding them.
Oh.
Nobody is scrutinizing them to know whether they're doing those things that they are supposed to do.
Hmm.
That is also the reason when we are discharging people from the rehabilitation center, we have to go to the house to make sure that there are no remnants
Yeah.
of those things that they were taking that would be
Yeah.
still remaining.
Yeah.
Because some of them, they hide it in such a way that parents even don't know where it is, so they can't find it. So most of them, their parents are not always around them. And because of that, they are more comfortable doing those things. Just like you said, there's no distraction. Nobody is telling them,
Yes,
hey,
nothing.
hey, John, have you done your homework? Because going to do that homework will take me away from thinking
That's true. That's true.
taking that substance. John, okay, come and go and get fetch water. Those things are things that will distract them from thinking deeper into the euphoria, into the satisfaction they got from that substance initially. And then if it's just once that they got involved, it may not lead to addiction because there's no repetition. What causes addiction is the repetition that the brain goes through.
Oh, and just to
Like you said now,
yes.
those ones were there that were taking that in repeatedly.
Yeah.
The other ones, they're being distracted, they'll just come sip
Just
and
sip
go.
it and then-
So the quantity also matters.
Okay, that's true. That's really true. So we've had this. Is very important to be present, in the life of your child. I don't think we can overemphasize it. I know the country is demanding a lot from the citizens.
Yeah.
So cost of living has skyrocketed and all that. But as much as possible, find time to be with your kids because you don't want to do all the work,
No.
have all the money, and you are trying to get your child out of drugs at 40. Your child is 40 and maybe you are 65 and you're trying to get your child out of it's crazy when you see an adult, an addicted adult that can't function, in a place. So there's this thing also that we also noticed in the little I do, we notice there's a gap, there's a window that is very dangerous for Nigerian kids between the time they are writing exams, like between the time they finish writing Pinnacle and maybe JAM to the time they are entering the university. So that's when many of them get hooked up in this substance. Have you noticed that same trait?
Yes, it's the trend because when they now finish in school, they get if they are the types that are being supervised properly, they get involved in the academic. So their mind is there. Their mind will not go any other way. But after the whole rigor of exam and all those, they come out and will think, I have to rest now. It's time for me to probe further into life. So, and at that point, that is when they will have opportunity of going out to be with their friends, to call them, to chat. And then at this point, that is also the time, the opportunity they have to watch some movies, some videos. And then if the parents are not taking time to find out what they are doing at this period, they may derail. Most of them do. And that is why I am saying that parents, guardians, relations should watch their words at such time that there's a form of excess freedom for them so that they don't misuse it.
Yeah. So it's this thing, because we're looking at the biology of addiction, genetics, if it's hereditary and all that. So what happens to the brain, of someone that is addicted to any substance? Can you vividly describe it? Because we just want people to understand.
Let me see if I can. What happens is there's a part of the brain whose work function is to monitor what is going on in the life of the person, to take decision, and to watch, to control the emotion, and then the ability to take decisions and to operate properly. There's a part of the brain that does that. But what happens when somebody gets into drug? The first thing that happens is that ability is suppressed. Then the other area that would want the person to just go all out is activated.
Without thinking.
Without thinking.
Like a bypass.
Yes. So now this one is suppressed, this one is activated. So that drug, when it happens, a lot of neurotransmitters, dopamine, let me just use that word. That is the euphoria, rejoicing hormone. They are produced much more than necessary because the brain produces them in a controlled level, at control level. But when drug comes in, it is excessively produced. Now that it's excessively produced, it produces excessive satisfaction. And at that point, when it's repeated, the other area I told you that records memory will see that thing happened when a certain substance came into the brain. And then when that person thinks about that substance, that part of the brain will say, go for it. Because that's the only thing that matters at that point in the life of that person. It's like it has reset the brain to recognize that substance as the only thing that will make him human being. That is what actually happens. And although we have also seen from some scan procedures that there may somehow be some damages in some portions of the brain that happen in the portion of the brain.
Is that bad?
Is that bad? And these damages, some of them take a very long time to heal. That is why detoxification and rehabilitation does not heal that personality. Until that psychotherapy is given, and that period of time that psychotherapy has to be given to help the brain recover itself. Yes, that's what happens.
Wow. Wow. And it's sad.
It is.
It's sad too. And why I'm very touched by this is I came close to abusing substance because I was introduced not once, not twice. So it's making me think the number of good people out there. I don't want to call myself good, but relatively, as a child, I never gave my parents headache. So beyond the normal one, you fought here, but things like abuse and certain things. So, but you see, this whole thing is rampant, it's everywhere. So, what are the roles? I want to look at the roles that the government will have to do to curb this, and then maybe we'll look at the roles. We'll look at the roles parents
Yeah,
I think we've
partially.
looked at it
We
partially.
have looked at
So
it.
okay,
Yes.
let's
Let's look
clean
at
it up. Let's
yes.
conclude the roles parents have to do to just curb this madness. And then before we look at the roles government have to also play to just stop this.
The role parents have to play is
Yeah.
first and foremost the role that they should play, everyone should play in his or her family. Care,
Oh, okay.
love.
Okay,
Then
not Cain.
not Cain, not Cain. Then empathy. They should
Oh.
understand. Often what push these clients away even from the love of the parents is because the parents would want them to behave well and then begin to criticize them and then begin to compare them with their peers around.
Oh.
That person will not see himself as useless and then would want to do that thing you are saying his peers are doing. And in the course of trying to do it, he'll misstep. So parents should stop this. I told you before, you have to stop it. No,
This useless
because this useless boy called names.
yeah.
No.
Labels
Because
them.
at this point, they are not the ones controlling themselves. They have been overtaken by this thing. So parents should still show love and empathy and then help them to recover. Take them to the right place where they can be properly taken care of so that they can recover and come back to their normal selves. They are not the ones doing those things that parents see them do. They have been captured, or do I use the word kidnapped?
Yeah.
By this substance. And in this kidnap scenario, except external force comes in,
Yes.
there will be no release. There's no release.
That's
so
true.
that's how parents should see their wards who are addicted and then show them empathy, show them love, and help them out of it. I told you earlier, that is why when we book the client, we book the parents, because except they understand this physiology that this child is going through, they will not be able to help that person.
That's true.
Let me tell you, even after detoxification, the problem of addiction withdrawal syndrome is still there. It may happen while they're taking the drug. Yes, that one we can control it, we can help them. But even when the drugs are out, parents would expect that, he's fine. Nothing is any longer inside of him. But then that threat, that push, that anger, that attraction towards going back is still there. Up to some number of years.
Wow.
For some people.
So
depending on how long they have taken it.
Okay, that's what they call post-addiction.
Yes, post-addiction withdrawal syndrome.
Okay.
Some of them may be very acute. Within the very first 3 months, you see them. That is when the urge is more. And at this point, that is when the parents will see that child as though he has started again.
Okay.
Oh, John, you have started again. I told you.
And the child will just feel that they don't believe in him
anymore. And then what is life all about?
Oh.
Because at that point, they have come to the very low ebb of their human understanding. So they will now see life, and that is when they will now start hearing voices, and the parents will think that this child have started again. They have not taken the drug. So it is at that point they need to bring in the experts again to help manage those people.
Yeah, I've heard this saying that kids, they rise to the level of the expectations parents have for them.
That's right.
So it's very important to I expect you to behave better. I expect you to act better. I expect you to. It's better you do this than I don't expect you to become somebody in life. Okay, so thank you very much for this. So we'll look at the government now. And what the roles the governments are supposed to play to stop this.
Yeah.
Yes, sir.
The government actually have the knife and the yam.
They have everything.
They have everything.
They have everything.
So good they're saying the government has set up in our country, for instance, the government has set up drug regulatory agencies, like the NDLEA, for instance.
And I heard they are trying also.
They are doing their best,
Yeah.
but it's not yet enough.
Absolutely, it's not.
And then the government also need to trickle this down to even the local government and the wards. Just like they have created the federal, the state, the local government, the wards for political reasons. Those agencies have to also be functioning there.
Mm.
And then government should have a way of regulating
Mm.
detoxification and rehabilitation centers.
Mm.
Because if these centers are up to standard, the issue of relapse will be minimized
Yes,
or
that's
brought to a
true.
very low level.
That's
Then there won't be clients for these drug couriers.
That's true.
So every effort that the government is making, it should not just be criminalization.
No.
Like
it should not
NDLA
be.
has also gone into detoxification and rehabilitation
That's
of
fine.
these people.
How many of these centers do
But
we have in the
then,
country?
how many of the centers do we have?
Okay, like in Abuja now, how many do we have in Abuja?
In
Are they up
Abuja,
to-
in Abuja, for NDLEA, they have only one rehabilitation center.
I don't know, that's little.
But there are other private centers that are scattered
Yeah.
here and there.
Yeah.
But what they are also doing there is not something to write home about, as it were. That's why I am talking about government creating a standardization program
Mm.
that people must follow. And it has to be through NDLEA because they are the ones who
Yes,
have the
yes,
right
Yes.
to control drugs in this state.
So we are looking at legislation now.
I'm looking at there is legislation, but I'm
Okay.
looking at cascading down the rehabilitation centers that are of international standard. There's no
Okay.
such as it were now in Nigeria.
Wow.
And then I think NDLEA should take up that challenge and begin to do it. Because if they have a standard detox and rehab center in NDLEA, they will now be able to go to the private sector and tell them what they should do. And they must do it. Otherwise, that place should be closed down. Do you know that in some of these so-called detox and rehabilitation centers, they still use crude way, chaining down these
Yes,
people.
I've seen it. In fact,
some of
that's
them.
even the norm. I grew up
Uh-huh.
seeing it as a norm that if
Good.
somebody is addicted to any substance, they chain them.
No, that is a very bad and
Oh, they're
cruel
not
way
supposed to
do.
chain
They're
them.
not. They're not supposed to chain them. You are supposed to detoxify them. Granted that at the early stage,
yeah.
they may become violent
Yes, because
that thing has
I was
gone
about
beyond
asking
their
you,
control.
like, how do you handle when they are violent?
Yes, when they are violent, what you do, there are drugs that they are given.
Oh,
There are drugs you give them that will quieten them.
oh, that will just
That will
calm them down. Oh,
And then there are also drugs that will act, but at a lesser level,
okay.
like that addictive drugs.
Oh,
So those ones are medically assisted therapy.
oh.
You give it to them, they will feel they are still high. In this real sense, they are not high.
Now you're
But
making
that
me
you
have
now
so many questions.
you will now provided opportunity
Yeah.
for that person to come down to a level of sanity that he will start seeing reason why he should get out of this and then follow you to get out of it.
Okay.
Yes.
So now the medical assisted
Therapy.
Yes. Now, because I understand it involve the prescription of certain drugs.
That's right.
So, but don't people become addicted to those drugs?
Okay, no, they won't become addicted to it because
Why?
it's a control level that they are given.
Okay.
At
But
that
if it's not
control-
controlled, they could be
If it's not
addicted.
controlled, they will be addicted.
Oh, not they could, they will.
No, they will. They will
Oh.
surely be addicted.
Okay.
Because it's part of this addictive drug that you combine with another one, which will interact and block what I call the receptors. That's I told you about the messenger going
Yes.
to tell some the other one.
Yes.
That is the receptor.
Mm.
Now, if you use that particular drug to give them to block the receptor, but not to crash, because what happens, why they suffer withdrawal is when that is crashed, and the brain on its own regenerates itself, repairs itself by what we call neuroplasticity. At this point, what happens is that there are many neurons, many of those receptors accepting the drugs. What the brain does naturally is to start blocking those receptors and then rechanneling the route for messaging. That's neuroplasticity. That is the same method that is being used when it comes to medical assisted therapy.
Oh.
You give them that substance in a lesser quantity that will not make them violent.
Okay.
Then you give the other drugs that will block the receptors to those drugs that will make them to become violent.
Okay.
So now there's a balance.
Okay.
At this point, the person is calmed down. The person is now returning back to his or her senses, and then will be able to know the reason why he is at the place he is and why he should not go to the other side again.
Oh.
Yes.
Okay, so thank you very much.
Thank you.
We are still on the government
Yeah.
and the roles they should be playing, and we're going to continue it in our next segment. But there's something that he will not be answering, but you, if you are watching us, I want you to respond to this question. There's something he said. He said there's a very, very direct relationship between hardship and substance abuse. And then the question I wanted to ask is, if we look at President Tinubu, President Muhammadu Buhari, President Jonathan, President Yaradua, or Adua, thank you, President Olusegun Obasanjo, among these people, does it look like Nigerians we abuse more substance than the other? That's a question for you, our audience. That's a question for you to respond to, and we want to see all things being equal. Just look at the economics alone. The president that is likely to have more people abusing substance. Now, back to this also, I want us to switch gears now to sport betting. Okay, and this video for sport betting will be available next week.